This is Dr. Rucha Kulkarni. I'm a dentist by profession with a master's degree in orthodontics and dentofacial orthopedics. I'm a consultant dentist with Just for Hearts, your wellness partner. I welcome you all today on the occasion of World Oral Health Day 2021. This Awareness Day is celebrated every year on 20th March to spread the awareness about maintaining oral hygiene in general for all the general public. The theme for the campaign of this year and for the next 3 years is going to be proud of your mouth. In other words, it means take good care and value your oral cavity. The message is simple yet very strong. So guys, I'm here to give you some tips and tricks how you can maintain an excellent oral hygiene and be proud of your mouth irrespective of the age group you belong to. A good oral cavity is a reflection of your general well-being and a good health. It is very important to maintain oral hygiene for the proper functioning and everyday daily tasks. It is never too early or too late to start looking into your oral cavity and taking good care of it. Your body will thank you. To begin with, let's understand what can happen after prolonged neglected oral hygiene. Well, neglected oral hygiene can end up in situations like dental decay, gum diseases, loss of tooth, stained teeth, dry mouth, and the worst of all, oral cancer. We all know that dental decay often leads to painful teeth. Sometimes the pain is so much that you feel like ringing up your dentist in the midnight. Gum diseases, if progressed aggressively and went unnoticed, can end up in situations when there is loosening of teeth and eventual tooth loss. A lost tooth has its own debilitating effects and affects the quality of one's life. Dry mouth has its own bad effects. And to name the worst of them all, oral cancer can even cost someone his life. Well, let's see what all we can do to maintain excellent oral hygiene and make sure that we don't end up in any of these situations. First of all, let me stress enough on the fluoride ion. The fluoride is the most important ion when it comes to maintaining good oral hygiene and preventing your teeth from having dental decay. So guys, first of all, today's first exercise will be, you should go back and check your toothpastes and check the ingredients. If your toothpaste doesn't have fluoride as an ingredient, kindly dump away your toothpaste. Go and have a fluoridated toothpaste. A lot of over-the-counter fluoridated toothpastes are available in the market. For that matter, you can go and have your dentist's prescription for the same. Second thing, let's focus on a simple tool that helps us in a daily task, which is the most underrated task, that is the brushing. Our dear toothbrush. Put into a habit of using a toothbrush for brushing your teeth. The basic thing of cleaning your teeth. Avoid using only your finger or anything else. A toothbrush should have soft or extra soft bristles. Kindly avoid using toothbrushes with medium or hard bristles. Get into a habit of replacing your toothbrush every 3 to 4 months. If you see that the bristles are getting flared up, it's time to say goodbye to your toothbrush. Now let's understand the frequency and duration of brushing every day. We should be brushing at least twice daily for 2 minutes each. There is no bargain with this. Now, have you ever thought if you know the right technique of brushing? Now let me give you a quick demo of how you can effectively brush your teeth for gaining the best results out of it. Well, start by using circular motions along all the outer surfaces of your teeth in this manner. You can do it in any direction, whether clockwise or anti-clockwise, as you wish. Once circular motions are over, try to remove all the food that is between your teeth with up and down strokes. Angle your toothbrush along the gums in this fashion and then try to swish it out. Try and avoid horizontal strokes. However, if need be, you can use light to and fro strokes. Once the outer surfaces of all teeth are done, then you can go ahead for the chewing surfaces and the inside surfaces in a similar manner. Don't forget to clean your tongue with a tongue cleaner or a tongue scraper, as the tongue harbors the maximum number of microorganisms in the oral cavity. Now let's also see how we can store our toothbrushes correctly. So after your brushing is done, so store them upright after you wash them properly under running water. Let them air dry completely before using them again. Try to separate your brushes from others if you are keeping them in the same container. This prevents the cross contamination. Now, after the brushing, I would like to stress upon certain supplemental aids that we can use that can further help us clean certain areas where the brush can't reach. Well, the most commonly used interdental aids to enable one to brush properly with additional supplements include the floss, interdental brushes, pre-threaded dental picks, and some other equipments like water flosser, etc. I'm going to give you a quick demo of how you can floss your teeth for removing the plaque that is accumulated in between the spaces of the teeth where the brush can't reach. This is a threaded floss. Just take about 18 to 20 inches strand of the floss. Snap it out. Wind one part of the floss around the middle finger of one hand. Wind the remaining part of the floss along the middle finger of the second hand. Make sure your hands are clean. Now, hold the floss securely between the thumb and the forefinger and stretch the center part like so. Now with this stretched part, one tooth at a time, try to push the floss in between your teeth with an up and down gentle motion. Try to remove the plaque from along the surfaces of the teeth, from gums to down, or if you're using it for the lower teeth, from the gums to up. Do not do it in horizontal motion and don't be in any hurry. Do not snap it into your gums, otherwise you might end up with bleeding gums. If you find it difficult to floss, you can use interdental toothpicks which are prescribed by a dentist, or interdental brushes which are bristle brushes which can help you remove plaque from these areas inaccessible while brushing. Now, quite often people complain of having dry mouth. Dry mouth is a situation when there is lack of saliva in the oral cavity or there is less production of the spit. So you can avoid having dry mouth, as dry mouth affects your regular tasks like eating, chewing, swallowing, speaking. So you can avoid dry mouth by drinking water regularly, having sugarless drinks, eating candies that will stimulate your saliva. Make sure these are sugarless candies. You can even visit your dentist and get a prescription of drugs for enhancing the salivary flow. Now, quite often, oral cancer is a debilitating condition seen in people in the oral cavity, and it can affect any part of the oral cavity, even the tongue for that matter. It is often seen in people above the age of 40 years. The best way to avoid oral cancer is avoid any type of tobacco, be it in the form of cigars or pipes or tobacco chewing or whatever. E-cigars are available, but scientists are still not sure whether they are as effective. Also, we all know that e-cigars vapor contains cancer-causing chemicals. If you're already into the habit of smoking, you should be having alcohol in moderation and have a good diet. So now let's see, when should you see a dentist? A regular dental visit is so important. You should ideally visit your dentist at least twice in a year. In a regular dental checkup, what your dentist does is thorough cleaning of all your teeth and taking certain x-rays where there is a possibility of hidden cavities. When you do a thorough cleaning, certain areas which are beginning to form decay are exposed, and your dentist can make you aware of the prevailing problem, and you can take preventive steps before falling into dire problems. So when should you ideally even visit your dentist, even if you feel otherwise healthy? When you have red, tender, swollen gums, when your gums bleed profusely, when you have bleeding gums when you brush your teeth, when you feel like your gums are losing away from your teeth, when you are feeling like your teeth are loosening up, when you have pain or you could see discolorations in your teeth, there is unusual sensitivity to foods which are sweet or hot, and maybe persistent bad breath and unusual taste of foods. So what exactly does a dentist do when you visit your dentist? When there is a general dental examination, your dentist thoroughly checks for any kinds of discolorations around your maxillofacial region or sores or any ulcers. There is an examination of your bite, the way you bite when your teeth touch each other. We also examine your temporomandibular joint for symptoms like clicking and popping or maybe even pain. Examination of all the soft and hard tissues of your oral cavity is done. In this case, if there are any ulcers or if there are any injuries or infections or precancerous lesions, this is the right time to detect them and highlight them. Also, certain decays can be checked. The condition of the old fillings can be checked. Old fillings are often a harbor of cracks and micro leakages which can lead to further problems. Your dentist will also look for any irritation or problems that are causing because of friction. So that's the end of our first session where I tell you about taking good care of your own oral health. Our second session involves for parents where they can be more aware of how to take care of their child's oral health. Well, cavities are the biggest chronic illness seen in childhood. But the good news is cavities are preventable. How can you prevent cavities in your child if you feel like your child could have higher susceptibility to cavities? Fluoride varnishes are an excellent way to prevent cavities in children. Also, dental sealants which are applied in a dental office are another way of sealing away the crevices of the chewing surfaces of the teeth and preventing the bacteria into entering the tooth and causing cavities. So for parents and caregivers, let me tell you how you can take care of your child irrespective of the age your child belongs to, whether your child is a toddler or has all the permanent teeth in the mouth. Well, you can take care of the gums of your baby by wiping away the gums with a clean cloth every morning after feeding and before bedtime in the night to make sure that the gums get rid of all the bacteria. When the teeth come and start appearing in the oral cavity, start brushing your baby's teeth right away with a brush with small soft bristles and plain water. Do not use toothpaste at this point in time. Have the first dental visit when your baby's first birthday is there. This is usually the time when the dentist can check for the erupted teeth and also if there are any potential problems. Visit the dentist if you wish for applying varnish or dental sealants in your child's teeth if you feel like your child is more susceptible to dental caries. For children younger than 2 years, consult your dentist regarding the use of fluoride toothpastes. Brush their teeth twice daily. Drink tap water because your tap water contains enough amount of fluoride in it. Ask your child's dentist to apply dental sealants when appropriate. If your child is younger than 6 years, watch them brush their teeth. If they are not able to do it by themselves, and if they have not developed enough dexterity in their hands, you should guide them for brushing the teeth and brush their teeth yourselves. Now in this child, you are supposed to use a toothpaste of the size of a pea that contains fluoride. Encourage them to use antiseptic mouthwashes. If your drinking water does not have enough fluoride to prevent cavities, do visit your dentist and ask for supplements in the form of lozenges, tablets or drops. There are certain protective foods that are preventing cavities. These foods include cheese, casein, peanuts, cocoa, lectins, certain fats. Try to involve them in your child's diet. Now that was about maintaining oral health for the children. Let's end the session with our third part, that is for our dear senior citizens. Globally, it has been observed that poor oral health among older people has particularly been seen in situations like loss of tooth, gum diseases, stained or discolored teeth, dry mouth, oral cancers, precancerous lesions, altered sense of taste, and whatnot. As age advances, the layer of the material under the tooth enamel starts getting exposed and gets darkened. It can happen due to cavities or prolonged consumption of tea and coffee. This stained layer could be a word of caution if it is giving pain or sensitivity. You should visit your dentist and check if you have any cavities or if your tooth is loosening out. Home care for dry mouth often involves sipping water regularly, avoiding use of mouthwashes that contain alcohol, avoid caffeine, aerated drinks, or acidic drinks. You can also have sugar-free gums that can stimulate the flow of saliva. Among old people, there is often altered sense of taste due to certain debilitating medical illnesses, use of dentures, or certain infections. Curing them is important to improve the sense of taste. Quite often, old people are the denture wearers. They should be taking care of their dentures by removing the dentures regularly every night, cleaning the denture in an antiseptic solution, and storing the denture away in an airtight container when they are not using the denture. Loss of tooth is a common finding in elderly people. If a lost tooth gap is left if it is left neglected, the teeth along the gap start drifting into the gap, causing bone loss. So once you feel that you have lost a tooth by itself naturally, or you have already went to your dentist and gotten it removed because it was moving, you should think of getting it replaced immediately. Various options are available. Your dentist will make you aware of all these options available. Denture-induced stomatitis is another condition which is caused due to accumulation of a fungus called as Candida albicans on the undersurface of the denture wearers on their tissues and also on their dentures. So when there is denture-induced stomatitis, there is inflammation of the tissues of the oral cavity. The most important aspect of treatment of denture-induced stomatitis is improving denture hygiene by removing the denture in the night and maintaining the denture clean. Many years of chewing and grinding leads to exposure of the tooth dentine, which becomes sensitive over time. If attrition continues and causes sensitivity all the time, you should visit your dentist and ask for protective layers that will prevent the further damage, which can be in the form of bonded veneers or restorations. Certain medical conditions such as arthritis makes one difficult to hold the toothbrush and perform routine tasks like brushing properly. For such people, you can recommend or you can start using electric toothbrushes. The electric toothbrushes also come with a Velcro grip such that even if you can't grip the toothbrush, you can just fasten it to your hand and then help yourself clean your mouth. There can't be any bargain when it comes to brushing your teeth twice daily, be it a toddler or an old geriatric person. Rinse your mouth with an antiseptic solution, that is the mouthwash, every afternoon after your afternoon meal. Avoid sugar. Sugar is the main reason for cavities. So you can try and make smart choices and avoid sugars in your diet. Brush shortly after snacking sugary foods. Get your recommended dose of calcium. It is said that every day an adult requires 1000 milligrams of calcium. You can get your recommended dose of calcium from your diet, and you can involve calcium rich foodstuffs like spinach, broccoli, milk in your diet. Even if you are a denture wearer, getting your teeth and gums checked regularly with your dentist is advantageous, in which you can stay a step ahead of the progressing problem. Well, this video was meant to enlighten you all about your oral hygiene. It is not intended to be a substitution for professional advice, diagnosis, or treatment. I wish you all a very happy and healthy smile, and may you all be proud of your mouth.